Welcome to the Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thank you for being with us. In a healthcare hub like Cleveland, home to several major hospital systems, including one of the top ranked in the country, it's hard to imagine that there are residents who struggle with access to healthcare. For a large portion of the population, this issue has historical ties to systemic racism and disenfranchisement that continue to affect people of color today in Cleveland and beyond. Research shows that Black Americans are more likely to see higher rates of infant and maternal mortality, but less likely to seek and receive mental health support or treatment. They're also subject to greater discrimination in medical education. These kinds of disparities date back and directly stem from the eras of slavery and Jim Crow laws and a history of medical violence that has led to a distrust in the system. Today, joining me in studio to discuss what health equity means, what Cleveland is doing to support its residents of color, as well as his new book, Liberated Mind, is Dr. Timothy Goler, Associate Professor and Sociology Department Chair at Norfolk State University. Dr. Goler has his PhD in sociology. Tim, welcome to the show.
Thank you.
We also have with us Stacy Easterling, Executive Director of the National Institute for African American Health, based here in Cleveland. Stacy, welcome.
Thank you.
And with us as well, we have Lita Wills, Commissioner of the City of Cleveland's Division of Health Equity and Social Justice. Lita, welcome to the show.
Thank you for having me.
If you would like to join this conversation, you can give us a call at 866-578-0903. You can also email us at soi@ideastream.org, or you can message us on Instagram at The Sound of Ideas. Maybe you have a story you'd like to share about an experience you had where you weren't able to equally access healthcare, or maybe you have a question for someone here on our panel today. Whatever it is, we would love to hear from you. Now, Tim, in your book, Liberated Mind, you look at the connections between social inequities and mental health, which is a daunting subject, overwhelming to say the least, I would imagine. What inspired you to write this book?
You know, there's let me start with this saying. There's a saying that says, when a flower doesn't bloom, you fix the environment around it, not the flower, right? And so what really inspired me was growing up here in Cleveland, right? Observing the conditions that people grow under and how the conditions affect the way people think, and how they think and how they see themselves. And many times, too often, I've watched how people, institutions and whatnot, pathologize and medicalize people without really understanding the conditions in which people live. And so, I wrote Liberated Mind because the conditions, I fundamentally believe conditions shape the way in which people shape people's minds, and that and those things become internalized and shape how we see ourselves and see others.
Thank you for sharing that with us.
Yeah.
And we know this was published in conjunction with the National Institute for African American Health, which is based here in Cleveland. Stacy, how did this organization come to be based here in Cleveland?
NIA is an organization that was chartered in 2021 by a Cleveland doctor, Dr. Gregory Hall. Dr. Hall is a current internist at University Hospitals, and he has been practicing medicine in the Cleveland area for over 25 years. Dr. Hall has always been committed to improving African American health, and his vision came from wanting to improve health and also increase the number of Black physicians in the country. And he originally had worked on a program at Cleveland State University that was a pathway kind of program that helped young folks to matriculate to medical schools in Ohio. After that, he decided to take NIA national. So we are a national organization. We're chartered here, but our main purpose is to improve African American health. We have several ways we do that. One is we want to have trusted and reliable information available to African Americans. So we have our website and our social media to do that. And NIA Press is another way we can do that. And then we also have our flagship programs, NIA Scholars, which is increasing the number of Black physicians in the country by creating mentors. We have mentors that physicians in the country that match with pre-med students, and they help them on the journey. They know the journey so they can help others to get there. So we're trying to create the next generation of physicians.
A lot of work in a few short years, it sounds like.
It's a lot. It's
Sure.
an ambitious An ambitious vision.
Yeah. Now, Lita, you are with the Department of Public Health's Division of Health Equity and Social Justice. Can you tell us when that division came on the scene and what it is you do there?
Yes, similar to Stacy's story, we stood up the division in 2021. It was an offshoot of the 2020 Declaration of Racism as a Public Health Crisis from the City of Cleveland and Cleveland City Council. We are in the health department working on health disparities, obviously with health issues that have major health disparities between in Black and Brown communities like HIV/AIDS, infant and maternal health, mental health and opioid response, those types of issues. And then we also do a lot of work that spreads across city departments, looking at social determinants of health and understanding where racism is influencing all of our policies, practices, procedures across the services we provide across the city, and how to use social determinants of health to operationalize and measure our equity work.
So you examine, in doing that equity work, social determinants of health for Black Clevelanders. Can you tell us what are some of the common ones?
Sure. So obviously, the city of Cleveland, we have a very unfortunately high rate of infant mortality among Black moms. And we also have issues with Black maternal health care. We see in certain neighborhoods higher numbers of opioid issues and overdose. We are still one of the cities across the country that has one of the highest rates of new HIV infections. And so all of those things coupled together, really what we're trying to do is understand that it's not just the specific health issue or disease that we have to treat and prevent and deal with. It's the conditions, like Dr. Tim said, around us that influence those health outcomes. And so looking at social determinants of health, things like what influences our health outcomes, our housing, our access to jobs and economics, our access to healthcare, our access to education, quality education, that's what influences poor health outcomes or bad or good health outcomes, and we're trying to change that.
If you're just joining us here on The Sound of Ideas, we are talking about the well-researched, well-studied issue of historical inequity in healthcare when it comes to Black Americans. If you want to be a part of this conversation, you can call 866-578-0903. You can also email us at soi@ideastream.org, or you can find us on Instagram at The Sound of Ideas. We have a call now from Todd in Ward 1. Todd, welcome to The Sound of Ideas. Please go ahead.
Stephanie, Stacy, Lydia, and Tim. So I have a question for Tim and then a question for the group. Tim, does fixing the environment around a person or a group of people only become relevant depending on what their stage of development is at that time anyway? Is that something that should definitely be considered, what their stage of development is before you try or are involved in fixing the environment around them? And to the group, I keep up with infant mortality in the Black community, and I wanted to know to the group, do you think that Planned Parenthood prior to conception would be a major contributor to more healthy babies being born and then being raised?
Thank you for the questions, Todd. Tim, please.
Todd, that was a great question. I think someone told me one time, they said the burden is on the one who knows. So if a person's development is already at a place where you feel have a liberated mind, if you will, then I think that those people should help engage in helping to improve the conditions of the community that we live in. So, I mean, I do believe that conditions, and conditions are not just, conditions can be the condition of your home, your family, can be the conditions of what policy, can be the conditions that curriculum, education, so, a different way of looking at the social determinants of health, right? So in terms of the development of a person, I do think that it matters, but it also matters for how engaged that person is in terms of their engagement in their environment and the conditions.
Follow up for what Todd asked there for you, Tim. If it might be more ideal to maybe address some of these external environmental factors when someone is at a younger stage of development, does that mean that we should not worry about that when someone is at an older stage of development?
I would submit to you that age, in some sense, is irrespective. You can you can have degrees and have homes and be considered successful and still mentally confined, and meaning not understanding the conditions that have created the situations in which we live. So I think the earlier that we start, the better. But I think it's a lifelong process, so I don't think we really ever become. I think we always evolving.
And Todd's second question, which was about the infant mortality rate, we've been talking about very loosely the maternal mortality rate here among Black women, but the infant mortality rate, Todd's question, whether or not that might be made to be a better situation if people were planning prior to conception. Stacey, I'll ask you if you can weigh on that. I know you're not a medical doctor, but please.
Absolutely not a medical doctor. However, I do have an opinion on this, and I think from even Nia's point of view, we sort of operate with this space, and as he asked the question, I thought, education is power. So I think that, one, yes, people should take some time to be able to have the ability to plan, and one of those things is having education, having access to information that they can use in order to control their own fertility, to control their own health. And then also I add in that education, being educated, is part of how one can be healthy. So it helps them to understand themselves and actually where they want to go. So I do think the answer is yes, and I think that education is the key, getting access to information, and then also having the ability to direct how one wants to go in one's life by being educated. So, yeah.
And thank you for bringing up the fact of being able to control your fertility, because that's something that not everyone has access to when they don't have access to healthcare in an equal way. Lita, do you have anything you'd like to add on the topic?
Sure. I just wanted to add that, of course, planning, that allows us to be prepared and to have a better outcome. But studies have shown that when it comes to Black infant mortality, when it comes to Black maternal mortality, there is very little correlation between not being ready or prepared. You can have all the resources in the world, highest levels of education Black women have in this country, even among the highest income levels, still will be more likely to lose a child before their first birthday or die during childbirth when compared to their white counterparts. And so it's very, very important to understand that we have other things in our system at play that are placing this burden on Black women that no amount of planning and preparedness is going to help us with.
If you're just joining us here on The Sound of Ideas, we are talking about health equity and how Black Americans have been disproportionately not having equal access to healthcare at the same level as others here in our country. If you want to call in and be a part of this conversation, the number is 866-578-0903. You can also email us at soi@ideastream.org or send us a message on Instagram. We're at The Sound of Ideas. We do have a call now from Mark in Akron. Mark, welcome to The Sound of Ideas. I understand you have an experience you'd like to share. Please go ahead, Mark.
Yes, good morning, and thank you for taking my call. On Tuesday, I called in and told you about what I experienced with the death of my mom. However, I want to go into even a more disturbing fact. My mom, when she was alive earlier this year in 2026, she was bedbound and she was getting medical care from a prominent institution. People came to our place to do blood work on my mom, but when they came to our door, they didn't have no name tags, no. Some of them didn't even give me their cards, and because I brought that to the higher ups, they decided to let us go, which was a form of retaliation. Now, my question to your panel: what would you do if that was your parent? Wouldn't you want to know? Wouldn't you want to know who that person was? And just because, what if something had happened to your parent when they was getting a medical procedure at that time? You want them to be held accountable. I mean, that's ethical transparency. I would love to hear your panel's opinion. And in my opinion, that's like sophisticated racism.
Thank you for sharing that experience with us, Mark. And I'm sorry that you went through that and experienced that while you were dealing with the health of your mom. I'll ask Tim to weigh in on
Yeah,
that. And
that-
the rest of our
yeah.
panel would like to. Please go ahead.
You know, we often talk about African Americans distrusting the healthcare system, right? You know, but the distrust, as we just heard from the caller, the distrust is really is learned caution, you know, from kind of historical and present day experiences. Like, so the experiences that he's having or has right now. So a part of it is, you know, we must, you know, also ask the question about the healthcare system and what it has done to become trustworthy or distrustworthy. And so, you know, incidents like this, this is one of millions of cases, you know, where pain is dismissed, where concerns are minimized, you know, where unequal treatment happens, right? And to his point, a lack of dignity and respect. And these are just basic human needs, right? And so I'm sorry that he has to go through this and is going through a situation like this. But these are, you know, these are things that happen in the course of a day within the healthcare system in the United States.
I was thinking the same thing. I'm very sorry that happened to you. And what I thought about is we as Americans, as consumers of health, have to understand our rights. He has every right to be furious. He has every right to say something, and he has every right to say no. I don't accept this. I don't want this, and give me something else. So I do worry that we as consumers don't always understand our patient rights. And there are things like the Patient Bill of Rights that talks about all the things that you have the right to do. Every American has the right, and we don't always exercise those. So yes, you are absolutely justified in your fury, and you have recourse. You can reach out and say this is unacceptable, change it, and make something different happen for your mom's outcome.
Lita, anything to add there?
Just to add that that's a basic standard of care, you know, and if we are not afforded a basic standard of care, we are not getting our right and what we're responsible to. The unfortunate thing about it is we are often charged with, as individuals, trying to correct a situation after it's happened. What if we were offered the primary high standard of care that everyone else expects when we first ask for it? You know, versus having to constantly police a system after an incident has happened.
A little more context for Mark's call, and Mark, we do thank you for the call. Mark called in on Tuesday when our show was dealing with stress and the impact on the body and the mind. Anna Huntsman was filling in for hosting that day. You can find that episode if you're interested on the IdeaStream Public Media YouTube page. You can also find it wherever you get your podcasts. And Mark shared that he had been experiencing chronic stress since the passing of his mother. He was the caretaker for his mother. So Mark, we do appreciate you staying with us and calling in to share that experience today. Tim, I want to ask you now about some of the specific theories mentioned in your book, the bonsai and reconstructed self theories. Can you tell
Right.
us how those are connected and what that means?
Oh yeah. So, perhaps most people maybe have seen a bonsai tree. Right? It's just this it's a beautiful tree, right? But it's a beautiful tree that has been artificially produced by a process called miniaturization, right? The roots and branches have been wired and pruned, right, by a cultivator. And so it's a metaphor. It's really a metaphor that I use for the African American community in terms of, some of the kind of the miniaturized and dwarfed condition that many of our people have found ourselves in, placed in particular containers, right? A container, like I said, a container like policy. A container is curriculum. The container is some way the media portrayal, right, of us, right? So, and the idea is to understand the container and to break out, to find a way to break out of the container, to be able to understand. So, and so we can't understand the person without examining the conditions in which they're shaped, that shape the person. And so, and then there's another theory called the reconstructed self, right? And so the bonsai explains what has happened to us, and the reconstructed self is a theory that explains what we can do next, right? So how do you break out of the container? Well, part of it is, number one is you have to kind of unlearn some of the inherited beliefs that in old roles and old survival habits that in some instances have been good for us, right? Survival habits, but some of it was passed down through wisdom and love, but some of it was passed down through distortion and pain, and and so so we have to reclaim the authority over our mind. We have to align our identity with our values, so and then begin to live as a person that has chosen what we want to become, right? So those are the two theories in my book.
Okay. Lena, I want to ask you about some of the things that the city of Cleveland has been doing in this space around healthcare equity. Cleveland City Council declared racism a public health crisis. That was in 2020. That was in the midst of Black Lives Matter protests following the murders of George Floyd and Ahmaud Arbery. Can you tell us what the city has done since this declaration to address racism in our community, particularly in the healthcare space as we're talking about that now?
Sure. So we stood up the Division of Health Equity and Social Justice, which provides more support for those programs that are dealing with those specific health disparities that we talked about. We also stood up an interdepartmental equity team, which has members from all over City of Cleveland departments. So thinking Water Department, Department of Finance, Department of Aging, Department of Youth, all of those folks coming together to learn about social determinants of health and understand what is it that in the work that we do every day, no matter where you sit in City of Cleveland, that ties back to someone's social determinant of health area. Are you in a position where you are influencing what's happening with housing, with what's happening with economic development, what's happening with education? And we try to understand all of the work that we do in those areas and provide services to residents. Where do we have influence and impact to improve that area? And understanding where do we see equity gaps, where do we see negative health impacts, and how to fix that. In addition to that, we've adopted a health and equity impact assessment that we can use on programs, initiatives. We can run an assessment on a policy, a practice, a procedure to understand where do we have those equity gaps and figure out how to fix them. So that's looking internal to our City of Cleveland. There is also the Racism as a Public Health Crisis Coalition, which we work very closely with. That is an external community coalition body that acts as an accountability partner in this equity work with multiple community members and organizations sitting there. And we've also stood up an equity advisory group to the mayor, which again takes members from departments all over the city to understand and make recommendations for what equity initiatives we need and details of equity that we need to institute for staff, for community, and also in our physical infrastructure. So our physical spaces and buildings are also equitable.
Thank you for sharing that. Tim, I want to ask you, when Mark called in, we got into the issue of distrust in the medical space. That is well documented that there's been medical racism in America, which has created the system of distrust. Many other factors lead into this. Where do you think the responsibility lies, or what is the path forward to build trust with patients and the healthcare system in the Black community?
Well, in some sense, I think that becoming more aware for yourself about what you can do, yes, there's responsibility on the institution, right? There's responsibility on the healthcare system. But I think when you become more aware and understand, like Stacey said, about your rights, what power you actually have, how you can advocate, then that changes the dynamic, because the system itself understands that you understand, and you have more power in the relationship between you and the institution, right? So it's not to say that people are weak, not to say that people are don't have the capacity, but the more that I think that we can support one another, the more that we can have organizations like the City of Cleveland that has health equity programs and whatnot, that we can have programs like this to talk about it. I think it builds people's confidence that they can and have the power to advocate for themselves as well.
Stacey, I'd like to ask you about this from the National Institute for African American Health perspective, NIA, as we've been referring it to here. And the phrase, I want to make sure that I'm being clear in when I say the phrase building trust. I don't want to imply that there is necessarily always a reason to trust, because we do know that there has been medical racism. So when we talk about building trust on all sides of this equation, how is NIA approaching that?
Couple ways. And thank you for asking that. One is that we want to have credible and trusted information coming from, quite honestly, from people who look like us. So I think there's a trust level of a level of trust that comes when you're interacting with someone that looks like you. So one, we want to be that source of reliable and trusted information for African Americans and for everyone, but truly for African Americans. And then second, there's a phrase called ethnic concordance, and it's really looking at having the same, your practitioner, your clinician being the same background or ethnic background as you are. They have proven, studies have shown that ethnic concordance improves health outcomes. So if a person has a doctor who looks like them in front of them, they're probably more likely to trust that person. They're more likely to follow what they recommend as far as prescriptions and suggestions of how to care for themselves. So, and that can result in better health outcomes. So we're trying to look at different ways to embolden trust through information, through having more physicians that look like the patients that they serve, and then also have physicians who don't look like us, so non-Black physicians understanding the background, the culture, where this African American patient who's in front of them, where they come from, and how they process the healthcare system, how they process their own health. So understanding that is, I think, much more important for all clinicians to do, especially non-Black physicians, but also for African American physicians, just to be there, be present in those spaces. So we're trying to do it in a couple of ways.
Okay. Lena, I'd like to ask you about something that maybe doesn't get mentioned as often in the healthcare arena, and it is environmental racism when we're talking about the air we breathe, the water we drink, that kind of thing. So we know that exposure to pollution, toxins, and the type of housing that we're in, that can impact the health of people who are living particularly in poverty situations. Unfortunately, this began with redlinings back in the 1930s, and health risks and redlining are something that we see coinciding with each other in maps. Is that something that the City of Cleveland is looking at in order to help us get to better health equity?
Oh, yes. Within our all of our public health initiatives where we're, doing disease surveillance and investigation, when COVID was happening, I could point to the map blindfolded to where the majority of our infections were going to be, because it's our redlining map. Our infant mortality map is our redlining map. Our lead poisoning map, it's our redlining map, right? And so what the city can do about that is just exactly what we're doing, and acknowledging every point where the city has influence and impact, right? We have a Department of Building and Housing that most certainly can be pulled in on health issues and should be pulled in on health issues. We have our Community Development Department, which is responsible for developing all types of properties and businesses, looking at the environmental conditions of the land itself and where we are situating people, right? Division of Air Quality, that's monitoring the air that we breathe every day, because we know how important those external factors are to our physical health, but also our mental health. Looking at things like climate change and understanding the relative heat that happens in cities versus outlying places is so much different, and influences things like crime, influences, so many factors of our actual physical health, and what the city can do about it, right? We are obviously we can look at and monitor data like the average sale price of homes to know are people in the city of Cleveland being priced out of good housing, right? Understanding how many owner-occupied homes we have, doing things that the mayor's administration has been doing more recently of cracking down on things like absentee landlords and making sure that the public has access to housing that's up to code and safe. So a municipality, a local government has so much influence that they can exert over whether or not you're living in a good, safe, healthy environment or not, right? And I think it's tying those folks together, like all of our different departments, and working in concert with City Council, working with our neighborhoods and wards, for education, outreach, to understand what the resources are, making sure that the resources are spread equitably. That goes a long way in attacking these health outcomes that we've been talking about.
Tim, as your work as a sociologist and also with your relationship with the National Institute of African American Health, you have looked at the mind and the overlap between mental and physical health. So can you tell us, in your view, how health equity goes beyond access to treatment and extends into how we perceive ourselves and our needs?
Yes, I mean, health is shaped long before we get to the doctor's office. The health of a person is shaped long before that, right? So one of the things that we're trying to do is not treat the mind, the mind and the body as two separate appointments, right? Because as Dr. Hall says, the founder of NIA, he says health is whole. Health is the body, health is the mind, health is the environment, health is your identity, right? So all of these things. And as long as we continue to treat health as if it's just the consequence, we have to treat the causes as well, right? And so that's why it's so important, because ANIA, the National Institute of African American Health, it's not, they're not just about the physical, it's the physical and the mental, and so that's how you can talk about health as a whole.
It is really kind of wild how we separate things, right? You go to a doctor, it's like ear, nose, and throat. Our vision is separate. Our dental is separate.
Right.
It's all in the same head.
It's all in the same head.
It is very fascinating. It's all in the same head. As we wrap up here, Stacey, I want to ask you how the collaboration came to happen between Dr. Timothy Goler and NIA with the book Liberated Mind.
I want to let Dr.
Okay.
Goler talk about it, because it's a very personal, a very Cleveland story.
Yeah.
Yeah. Okay, let's hear it.
Well, Dr. Hall and I have been good friends for a long, long time. He actually used to be my physician at one point. And so we were having this kind of conversation. And he's a world-renowned doctor. And we talked about one of the things that just having this conversation, and we really are committed to trying to figure out how to improve the conditions of our community. And we said if we're going to continue to do this, we should come together and speak to the issue of health and in the most comprehensive way we can.
And this helped us having this partnership with Bonsai Publishing and Dr. Goler was a great chance for NIA to be able to promote education, promote trusted health information in a different way. Like I said, we have our website, we have social media, but to have information and publications available to African Americans it's just another vehicle for us. So it was a great opportunity, and it's a wonderful piece to start with.
And very serendipitous, unless it's more purposeful, that name Bonsai Publishing with the bonsai theory, the liberated mind, all coming together.
Exactly.
We appreciate you all coming together with us here today. I want to thank our panel, Lita Wills, Commissioner of the City of Cleveland's Division of Health, Equity, and Social Justice. Lita, thank you.
Thank you.
Stacey Easterling, Executive Director for the National Institute for African American Health. Stacey, thank you.
Thank you.
And Dr. Timothy Goler, Assistant Professor and Sociology Department Chair at Norfolk State University, PhD in Sociology, also speaking at the City Club of Cleveland tomorrow, this Friday.
Yes.
Thanks for being with us, Tim.
Thank you. It's a pleasure.
We appreciate it. We'll take a quick break now, and when we come back, we are looking outside the city of Cleveland in our next installment of The Menu. This is The Sound of Ideas. I'm Stephanie Haney. We'll be right back. You're with The Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thank you for staying with us. Areas of Cleveland like Tremont, Ohio City, and the downtown area are often the first thought when considering where to go out for a bite to eat, spend an evening, or maybe recommend to an out-of-town visitor. But what about the lesser-known areas, just a short drive away? Bringing the outskirts of Greater Cleveland to the forefront is the mission of a new series from Cleveland Magazine, where writers are diving into the gems in places like Canton, Oberlin, and Geauga County. In this week's installment of The Menu, where we dig into the region's food scene with the writers at Cleveland Magazine, we look at their new A Clevelander's Guide to write-ups. And with me to do that here, we have Annie Nikoloff, senior editor with Cleveland Magazine. Annie, welcome back.
Thank you.
Always great to have you here. And making her Sound of Ideas debut is Julia Lombardo. Julia, welcome to the show.
Thank you so much.
Very excited to have you here. If you want to join this conversation, you can call us at 866-578-0903. You can also email us at soi@ideastream.org, or you can message us on Instagram at The Sound of Ideas. Maybe you are in the areas of Geauga County, Oberlin, or my hometown of Canton, and you want to share some gems that you think need to be included in this conversation. Whatever it is, please do call. We would love to take your calls and hear from you. Now, Annie, all of you over at Cleveland Magazine are obviously well acquainted with how to cover what's happening in this town. So why did you decide to start branching out, looking a little further out?
Yeah, I mean, I grew up in Lorain County, so very familiar with Oberlin, which is one of the stories I wrote. And I think it's just such a great way to highlight what Northeast Ohio has to offer. It's more than Cleveland, more than the inner ring suburbs, right? And I think if you're from the east side, maybe you've never been out that way. If you've been on the west side, you've never been out on the east side. And it's just a good opportunity to showcase, I think vacation-worthy, day trip-worthy locations where, they have great entertainment, great food, great culture. I think every town has those aspects worth considering. And it's just an opportunity to get outside of our bubble a little bit. And we've had a lot of fun doing it.
Sure. All right, well, let's start with Canton, my hometown. Shout out to the 330 Perry High School grad. Julia, you profiled Canton. We're going to hear about some of the things that you wrote about. I'm going to chime in and add some things that I think people should know about as well. But a few cultural attractions in Canton, like the McKinley Presidential Library and Museum, the MAPS Museum, the Canton Art Museum. Tell us a little bit about those.
So believe it or not, this was kind of like my introduction to Canton. I had
Okay.
never really formally been there, but it kind of blew my mind how many museums there are in general, between like the Art Museum, the Maps Here Museum, the McKinley Library, Pro Football Hall of Fame, obviously. And like some of them are a little nicher, smaller, but like even those more nationally acclaimed ones, it's still kind of a point of pride of like, this is in Ohio, this is in my region. So it's really cool to be able to explore those on a closer scale. I was able to go to the Football Hall of Fame for the first time when I visited to work on this guide, and I'm a pretty passive football fan, but I actually had a lot of fun there. But another one that I thought was really cool to discover that we have is the National First Ladies Museum, which is kind of in conjunction with the McKinley Library. And I think that's like a really important part of history for these women's individual achievements. And it's cool, again, that that's a place that we can call part of our region.
Absolutely. Here's a little tip. If you're in Canton and you're trying to get a little heart pumping going, you want a little exercise, the steps at the McKinley Monument are very popular for running.
Okay.
And workout activity in general. There's a lot of steps. Don't ask me how many, but there's a lot of them. You will be winded if you run up, and then you will be winded when you run down. If people want a little fancy experience, what did you find that you would recommend in Canton?
We went to Gervasi Vineyards, which kind of blew my mind because it's like just this winding road, and it's all these Sicilian-esque buildings, and obviously you can see the vineyards where they start the wine production and stuff. And usually, wineries are associated with more rural areas and maybe like on the water or, like the big Italian landscapes and stuff. But it's kind of in a middle of the city, obviously, and it's a very urban area. And it's kind of cool that you're able to, emulate that more like vast landscape, kind of the retreat type vibe in a more populated city like that. We had some really delicious food at the Crush House, which is one of the few restaurants on the property. It's kind of just like Italian-leaning bar food. And obviously the wine was delicious. I did have to try some, like, of course.
For the job.
Yes,
for the
absolutely.
journalism.
Absolutely. It's very important journalism. But yeah, and I can see why it's a great wedding venue. It's a good day trip because there's a spa, there's coffee, there's shopping. Like, you can really waste a lot of time there.
Certainly. And I say this with all the love for Canton. You will be at Gervasi and you will not know that you are in Canton. You will feel like you have been transported
Absolutely,
somewhere
yeah.
European. It is tucked away and it's a beautiful gem. What about something more casual, Julia?
I really enjoyed Starflyer Brewery. It's a newer one in the city, and I liked it for the ambiance and the vibe very specifically because usually, breweries are more industrial looking. This one was very cozy. There was a big gallery wall, there was couches, there were these green walls, and I felt very comfortable there. And I'm also not a huge beer drinker, but I was really surprised by the flight selection of sour beers, IPAs, ciders, and they have just kind of finger foods, just little snacks and stuff. So not like a really, sit down and eat type place, but there's some really great restaurants in the area that I definitely have on my radar to try when I go back.
Lots of good ones. Lots of new ones popping up too. There's a lot of revitalization happening in downtown Canton, which I love. I will tell you two of my favorites, Canton staples, Taggart's Ice Cream, which is
I did go there.
delicious.
Yes, it was amazing.
And so charming. It's a family-owned operation. And then also Pizza Oven Pizza. I am the unofficial president of the Pizza Oven Pizza fan club. I have had it shipped to me in New York and Los Angeles when I was living there. You can do that. Okay, I will get off of my Canton soapbox now. It is amazing. I could bend everyone's ear about it for the whole show. But we will talk about the city of Oberlin next, Annie, which you spent some time there. How much time had you spent in Oberlin before writing about it?
So much time. I grew up nearby, so we would go after school. I would study in the Mudd Library for my high school classes, eat at the Fev, eat at these restaurants that have been there for so long, and very familiar. So jumped at the opportunity to include it in the series and shine a light on a place that I really love. Just love Oberlin. So.
Sure. All right, let's talk about some of the highlights. How much does the College of Oberlin play into the overall vibe and energy and landscape of the city?
Quite a bit. It's such a historic institution, and they own a lot of the property, a lot of the buildings. But what I find really cool is that a lot of those buildings are open to the public, and people can go to the Allen Memorial Art Museum. You can go to the Frank Lloyd Wright House. You can go to the Arboretum, which is an amazing park in Oberlin, or the Observatory, which I think it's one weekend out of every month they open it to the public, so you can go stargazing in there. It's just a lot of fun.
Okay, I want to talk more about that observatory. That is oh wait, this is in Geauga. Excuse me, I'm confusing my cities. We'll get to that in just a moment. But something that is happening this weekend in Oberlin is the Women's Decathlon World Championship. That's Saturday and Sunday. We did talk to two competitors here on The Sound of Ideas, Madison Lethy and Katie Strauss. So go back, check for that episode. That's happening on the campus of Oberlin College, the literal world championship for the women's decathlon. So just to shout that out for everyone, that's Saturday and Sunday. And it's free to attend. You can see these world-class athletes at absolutely no charge. So check that out. The events are scheduled. Okay, if folks want to grab a good meal in Oberlin, where should they go?
Yeah, a place that I tried for the first time for this story and that I will be screaming about from the rooftops is Teeny Thai. I think they're making some of the best Thai food in Northeast Ohio. You can't miss the building. It's right on the main street. Purple storefront, like totally funky interior. Small plates, which sometimes I worry small plates won't be enough food, but it was so fun to like mix and match with friends. The Brussels sprout dish there was like mind-boggling,
okay.
So recommend that specifically, but definitely try that out.
Okay. Tell us a little bit more about the Allen Memorial Art Museum.
This is like, if you love art and art history, it is a free institution. You can just walk in when it's open. They have a really expansive collection that they've been collecting, I think, for more than 100 years. So from all time periods, modern to, ancient art. They have Picasso there. They have Warhol pieces, like just an incredible collection that is just right there for everyone to enjoy.
You have a full list on Cleveland Magazine website about what you can do in Oberlin. As you said, you spent some time there. Any other spots that you think we should mention? Maybe the record store or anything like that?
Yeah, Hanson Records is a ton of fun. It's definitely a more eclectic space. It's upstairs on that main street in a small little storefront, but I do recommend checking that out. And I got to shout out the Fev, long-standing institution in Oberlin. If you go, you got to try it.
Okay, all right, the Fev, there you go. All right, Julia, let's talk about Geauga County, which is what I was trying to get you earlier when I was mixing things up a little bit. I want to ask you about something there specifically. Not just one city, this is the whole county. Tell us a bit about what you discovered there.
So kind of similar to Oberlin with Annie, I was raised right outside of Geauga County. So this was kind of a fun one for me to do because it kind of felt like a hometown tour. And it's all these hidden gems that I've known about for quite a while. And one thing I love about what we do at the magazine is being able to spotlight maybe places that we hold dear to ourselves, or, that don't get as much coverage, whether it's because of where they're located or their size or something. So that was something really cool for me to be able to support these places that sometimes fall out of our coverage area. But there really is so much to do there. I feel like sometimes people think it's more of a rural area with, farmland and stuff, which is the case. But I mean, I think my guide is like 34 spots across like 5, 6 cities maybe, and it doesn't even feel like I captured all of it. And there really is so much to do, and it's so many unique, small-owned places.
This is what I wanted to ask about, and I was trying to get to it before. The International Dark Sky Park, and this is one of only 200 in the country. Tell us about this.
Yeah, so I actually have not had the chance to go yet, and I'm like kicking myself that I haven't been yet, but it's in a area called Montville. It's the Observatory Park. It's part of the Geauga County Park District, and it is distinct as a International Dark Sky Park, which means that there's conservation efforts in place to keep it away from light pollution so that it's a really ideal place for stargazing and really popular attraction, maybe something that a lot of people don't know about. But I think, again, it's one of those things that you can be like, oh, this is in Ohio. Like, I can flex this in my area.
I've actually been there.
No way.
Incredible space. We went on a very cloudy night, so we could not see the stars, but we got to see their planetarium, which was fun too.
Very cool. Okay. Awesome. I'm planning on checking that out myself. Okay, this is the menu, so we have to talk about food. What are some Geauga County restaurants that you recommend to people?
One that I've always loved going to is Square Bistro, right in the downtown Chardon Square area. It's more like a casual but sort of upscale place, not like white tablecloth fancy. But there's 3 stories, and there's a sushi bar on the lower level with a lot of cool specialty rolls and like a really big menu. It's actually the first place I ever tried sushi. And they usually have some variation of like a surf and turf style roll that has steak in it or on top of it, which was like, for me, life-changing when I was trying sushi for the first time in high school.
Sure.
But they also have like pasta and like specialty sandwiches, appetizers. They have a really great happy hour. But that's one that I usually like to go to when I'm in the area.
Okay. Tell us a little bit about the shopping in the different towns in Geauga.
Definitely a lot of shopping between clothing boutiques. There's even a little bookstore in a city called Novelty in an old barn. It's like rare vintage books. One that I really love, again, in Chardon Square's Vintage Hollow. It's like one of those vendor-style antique stores with lots of different, jewelry, trinkets, postcards, other memorabilia, and it's honestly pretty comparable to some of the really popular vintage stores in the Cleveland area, I'd say. And it's one of those like real hidden gems that you're kind of lucky to stumble upon if you're in the area. But I'm a big vintage shopper, but there really is so much between clothing, decor, other things like that in the area. It's pretty saturated.
Some of the activities that people can take advantage of in Geauga County, just very quickly here: Alpine Valley skiing, Patterson Fruit Farm, there's a drive-in theater there, also Punderson State Park. So lots of things on Julia's list that you can check out again at Cleveland Magazine. All right, on the menu, we always end this segment asking our guests, what are you eating this weekend? Annie, we'll let you go first since you're the veteran. Julia, you think on it. Annie, where are you eating this weekend?
Yeah, this weekend, Jukebox, which is one of my favorite bars in Ohio City, they're celebrating their 12th anniversary. They have a few parties. I love the pierogies there. They have some pretty inventive combinations that you can get. So I think I'm going to order that and celebrate their birthday with them.
There you go. Okay, that sounds good. Julia, how about for you?
I'm going to Abundance this weekend, and it's my first time there,
okay.
which is crazy. I can't even believe that I haven't been there yet, but I'm obviously really excited to try the dumplings. I've been on the hunt for some Dan Dan noodles, and they have them on their menu, so I definitely think I might try those, but I'm very excited to experience the whole vibe of the place.
And Lou Feng, the chef there, one of Cleveland Magazine's most interesting people. We've had her here on The Sound of Ideas, so there you go, Abundance, checking
Yes.
that out. All right, I want to thank you both for being with us and sharing your Clevelanders Guide to ... fill in the blank. I'm sure much more to come. Annie Nikoloff, senior editor with Cleveland Magazine. Annie, thank you as always.
Thank you so much.
And Julia Lombardo, also an editor with Cleveland Magazine. Julia, we've loved having you here. Can't wait to have you back.
Thank you.
All right, if you missed any part of today's show, you can hear a rebroadcast tonight at 9 on 89.7 WKSU. You can also find every episode of The Sound of Ideas wherever you get your podcasts and on the IdeaStream Public Media YouTube page. To get the last word on today's topics, you can email us at soi@ideastream.org and find us on Instagram at The Sound of Ideas. Yesterday, we talked about youth sports culture in Northeast Ohio. William wrote in, With today's youth and some of the emphasis on sports, I wonder how much of what is happening is because the sports are fun, and how much is the parents living out their fantasies via their children and pushing the children too hard in the sports realm. I have heard at least one youth saying that they engage in their sport because their parents want them to participate at a high level, and therefore they respond to their parents' wishes. I do not know how widespread such an attitude is, but the expansive programs existing today suggest that it might well be more prevalent than people realize. Sports should be fun. Thank you for your thoughts on that, William. We also discussed a new novel, Cleveland Curse, by first-time author Dave Eifert. In it, he talks about the Cleveland Browns and the well-documented tumultuous history and sprinkles in some fictional narrative there. Tom wrote in, "The curse of the Cleveland Browns is the Haslams, the billionaire owners of the Browns, and the fact that Deshaun Watson is still part of this team. I will not watch any game he is a part of." Thank you for sharing your thoughts, Tom. You can find the Cleveland Curse book wherever you get your books and at local bookstores. Tomorrow on The Sound of Ideas, it's the Friday Reporters Roundtable. I'll be filling in as host with Mike McIntyre away. Our guests this week will be Zaria Johnson and Kabir Bhatia here at the Idea Center. Sarah Donaldson will join us down at the IdeaStream State House News Bureau in Columbus. I'm Stephanie Haney. Thank you for keeping the conversation going. I will talk to you tomorrow on the Reporters Roundtable. We'll see you all then, everybody.